All right. Good afternoon, everybody. I'd like to welcome you to our live discussion on cold weather safety. My name is Kate Hedlund. I'm Cook County Health Senior Communications Manager. I'm excited to introduce you to our wonderful panelists who are here today to give you some tips on everything from cold weather safety to when to seek out medical attention. I would like to thank our guests for joining us today, and they're going to introduce themselves in a moment. But first, this is an interactive discussion. If you have any questions for any of our panelists, please write them in the chat and we will try to get to them. Now, on to our discussion. I'd like to have each of our panelists introduce themselves and tell us briefly about your role. Dr. Abula, let's start with you.
Sure. Hi, I'm Umakant Avula. I'm one of the burn attendings at Cook County. So happy to be present and address some questions and hopefully prevent some of the common issues that can happen with frostbite during the season.
Okay, Ted Berger, let's turn it to you.
Hello, my name is Ted Berger. I serve as the Executive Director for the Cook County Department of Emergency Management and Regional Security. Grateful to be with you this morning.
How about you, Angelica?
Good morning, everyone. My name is Angelica Moore. I am the family nurse practitioner for the burn service. Happy to be available to hopefully answer any questions and provide some information.
Deanna?
Good morning, everyone. I'm Deanna Jackson. I'm the nurse clinician for the Department of Trauma and Burn, and I serve as the nurse educator and clinical expert for the nursing staff in the burn department.
And last but not least, Bobby.
Hi, my name is Bobby Marie Pollard. I am the burn patient care coordinator here on the burn service. I follow our patients inpatient and then also in our outpatient.
Great. Thank you, everybody, for joining us today and bringing your expertise. Ted, we're going to throw the first question to you. Can you talk about what your team does when it gets cold and what the season is looking like in terms of the weather forecast?
Absolutely, and thanks again for the opportunity to chat this morning. So we are the Cook County Department of Emergency Management and Regional Security. We play three critical roles here in Cook County government. First and foremost, we are the mandated emergency manager. Every county in Illinois has one, and we certainly play that role. We prepare for, respond to, and help communities and residents recover from overwhelming crisis events or disasters. We also deploy assets and expertise well over 400 times a year into our suburban communities to help them meet their needs, supporting first responders like fire department and police department personnel with specialty response equipment. And third, and finally, we make targeted investments to reduce our county's risk to overwhelming crisis events or things like acts of terror. When it comes to winter weather, our organization is front and center in helping support municipalities, in helping support our residents and helping them prepare for these events, and also making sure that we all take the time to consider what a truly overwhelming circumstance might look like for us. If I may, let's start with awareness and public messaging. We recognize that following the weather can often be a full-time job. And so we always want to encourage residents to be focused on a trusted media source. We recognize that this year, the climate pattern known as La Nina is predicted for the United States. This forecast will likely involve for our region potentially more precipitation than we would see on average. And we also can expect those temperatures to be up and down throughout the winter. We're also tracking likely more dramatic temperature and precipitation swings into the new year in the February and March timeframe. What we do to prepare is we work closely with our municipal partners to make sure that they have all of the equipment that they need. And to give you an example of the ways we support municipalities, we have access to over 150 specialty response vehicles, about 1,000 pieces of specialty equipment. Think about the need to deploy mobile heating ventilation systems when power outages strike. Think about the need to procure or bring to bear thousands or tens of thousands of bottles of water or meals ready to eat. These are all things that we do in a power outage, both in the summertime and certainly when it comes to severe winter weather. We also operate a very robust program to support warming centers across Cook County. And that information is available on our website. And certainly we stand ready to support residents by offering tips and recommendations through our website, through public messaging, and helping local first responders communicate those messages to their residents as well.
That's great information. Dr. Avula, from a clinical perspective, talk about cold weather and patient care. We've already had a few really cold days. I know people only worry when we have those sub-zero temperatures, but we don't really need the weather to get that cold for a health emergency, do we?
That's 100% correct. Our skin is a large organ that we all have, and it's honestly just a kind of a barrier, but it's also a great medium for like heat exchange. So fancy way for me to say that is just because it's not cold doesn't mean that you don't lose a lot of heat and you have the potential for injury. So in situations where it might be a little bit more wet, it is a little bit cooler. You do allow for that option to exchange heat at a faster pace, and especially in people that have multiple medical comorbidities, where they might not have the same ability to feel or perceive that something is damaged, or it might be a little bit more painful, then they kind of predispose themselves to being in a situation where they can develop, frostbite or worsening of their wounds. And the biggest thing is just recognizing when you're in a situation where you have to be a little bit more vigilant. So, for example, when things are a little bit cooler, if they're a little bit more wet, and especially when temperatures get below freezing, have to be more vigilant in making sure that you're warm, dry, and you're able to evaluate, your extremities to make sure that the most sensitive areas, like your fingers, your toes, aren't going to be compromised.
That's great information. Angelica, can you talk about when people should seek out medical attention? What are some of the warning signs that they're having an emergency?
Warning signs to seek out medical attention is shivering that stops unexpectedly, slurred speech, confusion, drowsiness, clumsiness, slow breathing, all concerns for hypothermia. Another frostbite concerns are skin that is hard, waxy, numb to touch, discolorations to the fingers, toes, or even the nose, white, gray, bluish discoloration, swelling, blistering after rewarming, are all medical concerns that should be sought out for medical attention.
That's great information. And Ted, that segues into my next question for you. The warming centers, what do residents need to know about accessing information and about when they're available?
Absolutely. So first and foremost, across the 135 municipalities in Cook County, every day there are warming centers available seasonally. And certainly in the summer, those become cooling centers, but during the winter weather months, there is a network of warming centers available. Many of these locations are trusted sources and trusted resource locations in our municipal governments. Think of libraries, potentially police or fire station lobbies, healthcare facilities. As of today, we have currently 19 warming centers that are on our website and available for use. In times of extreme emergency, when the National Weather Service issues a winter, perhaps a wind chill advisory or a wind chill warning, which would indicate extreme temperatures as low as negative 20 degrees wind chill predictions, we step forward and activate Cook County courthouse locations, 3 of them, to serve as 24-hour available warming centers. And the use cases are anyone seeking respite from the winter weather or seeking the warmth. We recognize that 24-hour access is important in those extreme weather events. And so we activate the Skokie, the Maywood, and the Markham courthouses to do this. We make notification to the media, so it's often a banner and information shared on open source news. And of course, we always put this information through our alerting system known as Alert Cook. I would encourage anyone who's interested in more information to check our website. Again, it is available at cookcountyemergencymanagement.org, and you can link to it as well. I'd also like to highlight that as the Cook County Emergency Manager, our primary jurisdiction are the 134 suburban municipalities. Our partners at the City of Chicago Office of Emergency Management Communications, they also maintain this information through their app and website, and the City of Chicago operates their own network of warming centers during times of significant extreme weather.
That's extremely important to know. Deanna, I don't think a lot of people realize that frostbite is treated by the burn team. Can you talk about what happens to the skin and who makes up the Stroger burn team?
Well, frostbite is a lot like a thermal burn, where it causes that dermal injury, deep injury to your dermal layer and your soft tissues, and your the skin becomes inflammation, there's swelling, and there's blister formation, and even in frostbite in the extremities, there's occlusion of blood flow, depending on how bad it is. So it is much like a burn, where it's causing that soft tissue injury. Our burn team consists of our burn surgeons. We have our burn nurses, and the nurse clinician, our burn managers. We also have our burn NP who helps out. We have a lot of burn residents who also help out with our team. And Bobby, our burn social worker, helps out with a lot of psychosocial issues that we have with our frostbite patients.
This is to anyone in the clinical group here. When somebody comes in with a frostbite injury, how is it treated?
First and foremost, it's an evaluation. So we want to get as much of the tissue exposed. So we want to take a good look to make sure, what the extent of the injury is. And then the next step is actually to minimize the progression of that injury. So if we see that it involves deeper layers, we try to actually give specific medications to allow some of the dead tissue to be removed, ideally without having a surgical intervention. But then, unfortunately, sometimes it does require more invasive procedures, but we try to minimize that whenever possible. The next step is basically just rehabilitation and preventing the long-term sequelae of any wound that's there. So whether that's contractures or whether that's like loss of mobility and function, but ideally getting them to a situation where that wound is able to slowly start to heal by itself. And it's just to be very clear, it's a weeks to months kind of recovery process. And so we really try to prevent the long-term sequelae when they first get here and progression of that wound from getting any deeper.
Bobby, talk about your role in the burn department. When someone comes to the hospital with frostbite, how does the social work team mobilize?
So for our patients who require inpatient admission, we do a full biopsychosocial assessment within the first 24 to 48 hours of them hitting the floor. We also do a concurrent public benefits analysis. So if we can identify areas of deficit, so things as far as not having Social Security benefits, not having food stamps, we're addressing those. All patients that come onto the burn service are appropriately housed and clothed. We think of frostbite as a preventable injury that occurs due to inadequate housing and clothing. So we work really closely with Legal Aid Chicago. We have a medical legal partnership with them. We do lots of referrals to their group for help with public benefits connection. And we work really closely with RISE. It's a medical respite center in Oak Park. They do really great work. We also work closely with our psychiatric and our substance use teams. Really, we try to meet people where they're at and help them in the ways that they feel like are going to help them, and then we give our recommendations. We try to involve natural supports whenever we can, family and friends, and then we do really close follow-up in our outpatient clinic. And so then one thing that I think is unique about burn is that our inpatient team is also our outpatient team. There's a lot of continuity of care. So we all work together. It's a really great team to be a part of.
That's incredibly important. Ted, back to you. Can you talk about what residents should have on hand during the winter weather and whether that's in their home or in their car?
So important to have these discussions in your home, or to pause and think about the circumstances that you may face, whether you are at home or in your vehicle in transit when a crisis may occur. Common scenarios this time of year are power outages in our home, or in our vehicle, some type of a flat tire, or perhaps being caught in dramatically changing weather conditions. Starting first with our homes, when we think about a circumstance where we might have an extended duration power outage, or we may, for whatever reason, be unable to access fresh groceries or food, we want to have a kit available. And in that kit, it's important for any extreme weather event to have a flashlight and extra batteries, to ensure that you have non-perishable food items stored, and a manual opening can opener, bottled water available, additional batteries, a basic first aid kit, certainly making sure that any necessary medications are also accounted for, blankets, sleeping bags, warm clothing, a fire extinguisher, and a smoke detector, as well as a carbon monoxide detector. And last but certainly not least, pet supplies. As we turn our attention to our vehicles, we want to recognize, again, something as simple as a flat tire could turn into a true crisis if you were in transit during changing weather conditions. In our vehicles, we always want to have ice scrapers and brushes, jumper cables, or a charger kit, a battery-operated charger kit that can help jumpstart a dead battery in a vehicle. We want to make sure that we have a small shovel, perhaps even a bag of kitty litter or sand to help you gain traction if you've run off the roadway or streets for whatever reason are impassable or unplowed. You want to have an emergency flare if you can purchase one of those, or at least reflectors with you. Extra blankets, warm clothing, water and snacks, but being mindful that we shouldn't store bottles of water in our vehicle this time of year because they will turn to ice. So bringing a bottled water with you in and out of the vehicle is a smart choice as well. And last but certainly not least, we are so dependent on phones. So we want to make sure that we have the ability to charge our phone if in fact we do not have access to electricity. Last but certainly not least, I encourage everyone to have a trusted news source to receive weather information, whether that's through a trusted media outlet or checking the weather forecast each and every day. This is a time of year when weather conditions can change quickly, dramatically, and you can always be best prepared with information. And please sign up for Alert Cook. That's our messaging system in true crisis events. Thank you.
I want to welcome Dr. Poulakidis. I see he's joined the team. If you're ready to answer a question, Dr. Poulakidis, I'm going to ask, what should people remember if they're going to be going outside in the cold weather?
Sure. My many apologies. We were operating on some sick people, so I apologize for being late to the party, so to speak. Many different things need to go through somebody's head. Obviously, we want to make sure we account for all our elderly. If our elderly are not accounted for, meaning they're not picking up their phones in their homes, we want to make sure they haven't absconded from their homes. And if they have, make sure that they actually have a cell phone pretty much attached to their hip, whether in a belt little application or in their pockets, so that if they do get lost, they could at least get phone calls so we can actually identify where they're at or find them on a cell phone app. The key things are multifold. When people have comorbidities, they're going to be more apt to actually sustaining frostbite. What do I mean by comorbidities? Other medical problems such as smoking, peripheral vascular disease, diabetes, they're going to get frostbite a lot sooner, as will people who have wet socks and shoes. Those wet socks and shoes make the degrees for freezing a lot higher. So instead of freezing at 32 degrees, they'll actually freeze at maybe even 45 or 50 degrees and sustain a significant injury. More importantly, people feel that as their pain goes away, as they're outdoors longer, that pain means that, I've actually adjusted to the temperature. That pain being lost and that sensation of pain being lost is actually an ominous sign that the tissue death is starting to occur, and those limbs are going to be compromised, and getting indoors sooner than later is going to be the most optimal. And if not, getting to a hospital or a warming shelter if they don't have that opportunity to get indoors because they may be undomiciled or what have you. So we really want to kind of highlight, obviously, we know we're on Facebook Live. Well, the people that actually sustain frostbite the most are undomiciled or homeless folks, are the ones that aren't seeing this, so that if somebody does see somebody outdoors in a very disparate type situation, contact the authorities, whether the fire department or the police, and have them reach out to these individuals and try to get them into the warming shelters to try to provide them the help that they so much deserve to prevent them from getting frostbite. Because on the flip end, on our side, the unfortunate thing happens that they come in very late in terms of presentation to the hospital, and they end up having significant amputations of fingers, toes, legs, arms, and the such. And so we really want to prevent that. We care about our patient population. We care about the community, and we really want to see nobody get injured. And to highlight, just preparedness is the key. You want to actually have, you might not be able to get the battery charger and everything, but a warm blanket and some survival things such as a telephone and some water is going to get you through a couple of hours until somebody to rescue can get there and then get to you and get you to a safe position. So that preparedness is going to be, optimal when you have, at least a set of gloves, a hat, and a heavy coat that can prepare you for at least a short duration where help may not actually be able to get to you. So I think just many things. Obviously, we don't want to see any patients injured. If they are, we want to see them at Cook County Hospital, where we will actually dedicate time, caring, love, and the ability to actually be able to get them to recovery into a safe place once their injuries have been resolved.
Last question, and this is for anyone who has who wants to contribute. What's one thing you hope people are going to remember as the weather turns colder this winter?
I could probably start out and then I'll let everybody chime in. We just want to get people indoors into some type of shelter. The city of Chicago is wonderful. And it's wonderful in many ways, and it's wonderful because our officials actually care about the population and getting them into these warming shelters, getting them into a facility, even come to the hospital. We'll find a way to get you into somewhere safe, even if it's just a bed for the night, until we can get you placed. And that's where Bobby is, our social worker, is optimal in terms of getting people in the right environment once they have presented to the hospital with injuries or even without injuries. We want to make sure that our community is safe regardless of the ability to pay or what have you.
Yeah, I'm happy to jump in. A few minutes of preparation today can make a significant difference tomorrow and throughout this winter weather season. We talk often about the February 2nd, 2011 snowstorm that struck Chicago, where hundreds of vehicles during rush hour found themselves trapped on Lakeshore Drive. And that was a significant, overwhelming crisis event where individuals, their vehicles ran out of fuel and individuals were forced to walk in 20-inch snow conditions with high winds. So something as simple as commuting home, which is something that many residents may do each and every day in a vehicle, can in fact put you at risk during the winter weather season. And so taking the time to pause and consider, even just for a few moments, what a truly overwhelming circumstance may look like for you and your family and your lifestyle and your home certainly can make a significant difference to be better prepared should you see an overwhelming circumstance. Thank you.
Yeah, top off the gas in those cars. It's ridiculous to think that you'd run out of gas. I get to 3/4 and I'm starting to get anxious of a tank. And, somebody with a quarter tank think I'm just going to make it home. It's just a quick jaunt home. Like you said, that February 2011 occurrence demonstrated very quickly that just a full tank of gas may have saved lives and prevented some injury. So just common sense type behaviors are critical.
Yep, just to pair, both those, Dr. Polokitis and, previously it was just an ounce of preparedness goes so far. Just minimizing exposure to the elements and just, staying on top of, these are things I need to do in the next couple of days. And if you have an opportunity to do so when you're bundled and dry and, you're able to minimize your exposure to the elements, that can go very far. And like Dr. P was mentioning, just keeping an eye on your loved ones, friends. This is it's a community first and foremost. So we all have to look out for one another.
Great.
One
Thank
last
you.
comment, if I could,
Sure.
Kate.
Sure.
We're on the time, obviously, where heaters may not work and space heaters get plugged in. I don't want people to close their eyes on those space heaters not being a very potential significant life threat. I know we're talking about cold injury.
Mm-hmm.
We see a lot of house fires because of the space heaters. Use very significant caution. Again, if you have family members that are living off of space heaters, maybe bring them into your home. Do something that's going to be potentially life-saving so that space heater doesn't superheat, then explode, then catch the house on fire, and then people die from smoke inhalation and significant burns. And so I know we're talking outdoors, but just some common sense indoor things too, just to prevent, major injury over this winter season. We want to see everybody enjoy the Christmas and New Year holiday and be home with their loved ones. We don't want them in the hospital. Trust me, if they need care, Cook County is going to provide the best care out there possible, but we want them all to be home with their families and loved ones and in a safe time.
Absolutely. On that note, thank you to everyone for joining us here today. This was some great information provided by everyone, and I'm incredibly grateful to the team. To receive text messages, updates about severe weather and other emergent events, subscribe to Alert Cook by texting Alert Cook to 888-777, and we'll put that in the chat below. And as a reminder, if you're in need of immediate medical attention, please call 911, but Cook County Health is available to help you regardless of your ability to pay or your insurance status. We wish you all a very safe and healthy holiday season. Thank you.
Thank you.
Thank you.